Hello everyone, how's it going? When I was doing some research on hypothyroidism, I came across something called subclinical hypothyroidism. So I was kind of curious what that was and if it requires any treatment. Well, if that sounds interesting to you, then keep watching. So today we're going to discuss what subclinical hypothyroidism is, who are more likely to have it, what the symptoms are, and what treatment is usually recommended. So subclinical hypothyroidism, it's also called mild thyroid failure, is when you have elevated TSH or thyroid stimulating hormone. But your T4 or your thyroxine is actually, those levels are normal. Now it's usually due to thyroid inflammation or some kind of thyroid disease. So what happens is the thyroid hormonal output doesn't increase like it normally should in response to elevated TSH levels. It is considered to be a condition that is not severe enough to cause symptoms. It is fairly common. It affects up to 10% of adults in the United States. It can lead to overt hypothyroidism, which definitely requires treatment. Subclinical hypothyroidism is oftentimes temporary, but it is possible for it to be long-lasting. So who are more likely to be affected? Well, those who are female, and especially people over age 65. Those with type 2 diabetes, and those who are pregnant may be dealing with subclinical hypothyroidism, about 15 to 28% of cases. Now, the subclinical hypothyroidism is more common during pregnancy than the overt hypothyroidism, and then it usually doesn't require any treatment postpartum. Well, what treatment is normally recommended and what symptoms should we be looking out for? Well, we'll discuss that in a moment. But first, I'd like to remind you to please like and subscribe if you're enjoying today's information. Also, make sure you check the links out below. You can read more information there and perhaps view some product suggestions. And if you have something you'd like to share on this topic, just feel free to leave a comment below. Alrighty, so subclinical hypothyroidism can be diagnosed with a thyroid blood test. Now, if you're experiencing subclinical hypothyroidism, your test will show that your TSH is elevated, but your T4 will be normal. Now, healthcare providers, they disagree about whether it should be treated. There are some conflicting studies on its effectiveness. There are some cases where they may recommend treatment, such as in order to decrease risk of cardiovascular disease and or to prevent it from progressing to overt hypothyroidism. Now, some cases, they may choose not to recommend treatment because they may be concerned about there's a potential for thyrotoxicosis, which will be too much thyroid hormone in the body. And this is especially a concern for those age 65 and older. Now, for most people, healthcare providers will just take a wait-and-see approach to see if it resolves on its own. Now, during pregnancy, healthcare providers don't typically test for subclinical hypothyroidism unless the person has a personal or family history of thyroid disease, if they have positive thyroid antibodies, if they have type 1 diabetes or some other autoimmune disorder or disease, if they have a history of preterm delivery, miscarriage, and or infertility, if they've had 2 or more previous pregnancies, if they're currently taking or they have taken amiodarone, which is actually taken to stabilize the heart's rhythm, or lithium, which is used to treat bipolar disorders. If they've had any head or neck radiation exposure, if they have a BMI of 40 or higher, or if they're older than age 30. Now, some situations where healthcare providers may recommend treatment for those dealing with subclinical hypothyroidism are when the person has a TSH level of 10 or higher. For young or middle-aged people with symptoms of mild hypothyroidism, for young or middle-aged people with other cardiovascular disease risk factors. Now, the American Thyroid Association recommends treatment for women who have subclinical hypothyroidism if they're receiving certain fertility treatments, so that their TSH level will be at 2.5. So, if your healthcare provider recommends treatment, it's usually a thyroid hormone replacement medication. So they may prescribe levothyroxine. But before they start this, they will do blood work within 3 months of an abnormal test result, and that's because in almost half of cases, the TSH will normalize on its own after about 3 months. Even if it does normalize, your healthcare provider will probably want you to get routine blood tests just to check your thyroid levels. Well, what about the symptoms? Well, most of the time people with subclinical hypothyroidism, they don't experience symptoms. However, sometimes they experience mild symptoms of hypothyroidism, such as fatigue, unexplained weight gain, constipation, depression and/or decreased attention span, cold intolerance, dry, coarse skin and hair, high blood pressure, and possibly frequent or heavy menstrual bleeding. Now, I had read before that it's rare for people living in the United States to have an iodine deficiency. However, worldwide, iodine deficiency is actually the most common cause of hypothyroidism. For those living in the United States, the most common cause of hypothyroidism is Hashimoto thyroiditis. Now, the risk of subclinical hypothyroidism progressing to overt hypothyroidism is about 2 to 6% per year. But because of the conflicting studies, treating subclinical hypothyroidism is still up for debate. So the best thing to do is to keep in good communication with your doctor. Make sure your doctor is aware of the symptoms you're experiencing, how you're feeling. You could even try an at-home thyroid blood test or have your doctor order one for you. But we're all unique, so it is important to talk to your doctor about your specific situation and what options are available to you. Because if we're experiencing thyroid dysfunction, it can really impact our entire body. And we really want to make sure that our thyroid is working properly so that we can feel our best. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.